you. The next question, please.
Plan if you are familiar with it.
If you don't mind, why don't you quickly explain what pure Medicare is, what Medicare Advantage is,
Right.
and what a supplemental policy is
Right.
for, so
Right.
people would
Thank
know.
you. We rehearsed. Medicare, as you all know, is Part A, hospital, which also includes some outpatient surgery. Part B, the physician part. Part D, which is the prescription piece that came about several years ago. Medicare Advantage was an attempt to take, you're exactly correct, some of the coverage intact and move it to the private sector. Sounds like a pretty good idea. It does have a lot of the encumbrances of managed care plans. A lot of the Medicare Advantage plans have pretty strict managed care rules of the road. So if you're comfortable with that, it's a perfect option. They are very competitively priced, and they stand on their own. They typically will cover all of the above. It will be all wrapped into one thing. It will also include prescription drug coverage. And so it's very similar to what you would experience in a normal employer plan. A Medicare supplement plan is a wraparound to the Part A and Part B. So a Medicare supplement will come in and say anything that Part A and Part B does not pay, we'll pick up and pay. Well, the caveat on the Medicare supplement plan is it will only pay if Medicare pays. So when we start having medical problems that Medicare does not pay, then all of a sudden we've got a hole in a Medicare supplement, right? Because they're tied. By definition, they're tied. So when we have kidney transplants and Medicare now only pays, are you ready for this? This is another example to tie into your comment. Medicare pays for only 3 years of anti-rejection medication after a kidney transplant. 3. Well, I'm not a physician. I have a lot of really good ones up here with me. But I think that you're on those anti-rejection drugs the rest of your life. So we have tremendous cost shifting from Medicare going into the private sector already. Well, these Medicare supplement plans literally are tied to and will only pay if Medicare pays. A Medicare Advantage plan was an attempt to develop a private sector solution and pull some of that off of Medicare. Makes good sense. To me, one thing we haven't discussed very much, due to time, it'd take us a 2-day seminar to tackle this one, is what we can do to make Medicare itself more fiscally responsible. Because right now, we're going in the hole on Medicare, $37 trillion, that's a T, and adding $1 trillion a year to the Medicare and Medicaid debt that we currently have, much less what we're looking at legislating. So, if I'm sitting here with a blank sheet and a legal pad of paper, I'm thinking, wouldn't it make sense for those of us that can to develop private sector solutions even for Medicare? Why doesn't Medicare itself have a Plan A designed on an HSA?
That's right.
What's so hard
I've
about
always
this?
asked a question, and this
Don't
is a
get it.
pure question because I have no idea if there's even a reasonable answer. But I would always wonder, of the people that are on Medicare, how many are wealthy enough that would opt out of Medicare completely? And obviously that may not be a very big number. I just want to know what the number would be. Has anybody ever polled anybody? Of the wealthier segment of our society, those with Medicare that would choose to opt out of the program altogether and give their spot up to somebody else.
Right.
I just wonder. There may be zero. I don't know.
Actually, I have 5 insured,
Well, there you go.
and they're all right here in West
And
Texas.
let's say it's not even that very many. Why aren't they having the right to do that?
Right.
That's the key. Here's something for you. In 1966, Medicare cost $3 billion. Okay? The House Ways and Means, with President Johnson, estimated, with cost inflation adjustment, that it would cost $12 billion by 1990. In 1990, it cost $107 billion. And you're going to give the government that calculator and figure that out again. Look what they did the first time. The personal responsibility issue comes all across the board. And what Beth is saying should be a right. You don't have to. Many people are on fixed incomes, and they've paid their taxes. We understand that. Don't touch my Medicare. But
Right.
you got to remember, Medicare only pays 80% of a fixed number.
Right.
The wraparound policy she was talking about doesn't cover other things. It only pays that 20% of a fixed number. So let me give you a little example. If my charge for a total hip replacement is $5,000, I don't know what it is. You say, how come you don't know what it is? Well, actually, the number that goes into the insurance carrier is indexed in our computer. It's a high number. Nobody gets charged $5,000 for a total hip. Medicare pays $1,700 for a total hip. All right? So, but Medicare pays 80% of $1,700. If you don't have that supplemental policy, you owe the other 20% to both me and the hospital. So what is the government telling you people? You have Medicare. I'll cover you. You got that 20% on your back, buddy. If you don't have a supplemental policy, the public doesn't have a clue. And whose fault is that? I try to educate my patients all the time. Some of our patients who have wonderful Medicare coverage can't afford to go in the hospital and go broke.
Right.
And that's on our government's check. They got a lot of nerve to get on the TV and tell you all they're going to take care of you. Get your checkbook out.
Thank you. Next question, please.
I'm Steve Presley from here in Lubbock. First, I want to thank the panelists up there and AIG for sponsoring this tonight. It's been very informative. My question is really, it may be a little